Thailand's Prime Minister and members of the cabinet were supposed to receive the Astrazeneca vaccine on Friday, but instead health officials announced a delay to the vaccine rollout after a number of reports of blood clotting in Europe.
There was one patient in Denmark who died, and there were other patients who had blood clots. Denmark's government announced the suspension because they were not sure. This is not to say it's related to the vaccine, but when such cases occur, for safety, we have to postpone the administration of the injections to allow further investigation to take place.
On Thursday, the Danish Health Ministry said it hadn't established any link between the clots and the vaccine, but would stop using the AstraZeneca jab for 2 weeks so it could investigate. Austria said it wouldn't use shots from one batch of the vaccine after a woman died soon after being inoculated. Estonia, Lithuania, Luxembourg and Latvia also stopped jabs from the same batch. And Italy withdrew another batch of the vaccine after 2 men died in Sicily, although no link has been established between the vaccine and their deaths.
In terms of the different interpretation of the different governments, that does relate, I think, to their own interpretation of risk and scientific evidence. But at this stage, there is no, I think, real evidence to suggest that the AstraZeneca vaccine is the cause of any major side effects. But more work does need to be done to determine that.
Several countries have said they'll continue using the AstraZeneca vaccine. France and Canada say the benefits outweigh the risks, and they see no reason to suspend injections. Mexico has expressed confidence, and Australia says it's monitoring reports of side effects, but has seen no evidence to suggest the AstraZeneca vaccine causes blood clots.
I would say that the ones that have been developed in the global north, as in the Pfizer, the Moderna, the AstraZeneca, the J&J vaccines, certainly the Chinese vaccines have a track record of not being particularly safe. And I would say, as long as it's not a Chinese vaccine, take it.
I want to go back to work and I want to be able to move around.
The US remains the epicenter of COVID-19 with more than 29 million cases and the world's largest vaccination program. 4 former presidents have urged Americans to get vaccinated as soon as possible.
This vaccine means hope. It will protect you and those you love from this dangerous and deadly disease.
Many other countries are struggling with the virus. Italy is braced for a third wave, and Brazil's healthcare system is close to collapse. Public health experts are warning the longer people wait to take the vaccines, the more likely it is more variants will emerge.